Well, hello to y'all. I haven't made a video in a while, so for that I apologize, but welcome to The Leap once again. A lot of things to talk about today. Last couple blog posts that I've done on my personal blog, which is hosted by parsonspersonaltraining.com. It's talked extensively about men's health, and in the last couple weeks, there's been a couple of decent stories that talked about men's health in regards to things other than sexual dysfunction. Yeah, that's all we seem to talk about when it comes to men: sexual dysfunction, maybe cancer, maybe heart disease. But everybody's been kind of wound up about the the RNC and the DNC and the debacles both of them were. So it's pretty easy to see why you kind of would miss a couple of big stories. Anyway, the first one that I really kind of focused on was definitely about prostate cancer. And there's an interesting little problem within the medical community about whether we should be, testing more often or testing less often. And there was a pretty crazy story that led to a big old hissy fit online between doctors and mathematicians and whatnot about the frequency of prostate cancer in men, especially in the 55 to 69 group. They were saying there was a jump in 72%, and in hard numbers, when you looked at it, it was a 72% jump, but in reality is more like a 0.001% jump as opposed to a 72% jump in regards to the test group they had. So it led to a lot of news agencies, because news agencies they don't do anything in depth anymore. They just went crazy about this until they realized it was really a comparison between hard numbers that caused the jump. And the thing is, while everybody was kind of arguing about this, they kind of forgot one important thing: is that prostate cancer is kind of, I hate to sexualize it, but it's kind of the man disease, while breast cancer is kind of the woman disease. So it's kind of the big cancer that all men sort of hate to think about, and we hate getting tested for it. And so it's really kind of an interesting battle. Personally, I believe, even though I haven't had a prostate exam yet, I personally believe it's always best to be on top of it, always test frequently, and do everything you possibly can to avoid it. And the best thing you can do for yourself, of course, is eat a very low-fat diet. Try to cut back on the high sugars, work out not work out excessively, work out consistently. Excessively, you'll kill your kidneys doing that. Anyway, that's kind of the main thing about prostate cancer. I've always believed that you should test frequently, live as if this could actually happen, because let's face it, if you do get prostate cancer, one of the massive side effects is you can lose control of your bowels, and also sexual dysfunction, which is really hard to fix once you get prostate cancer. And you're saved from it. Yeah, it can be a hard thing to deal with. So the great thing about prostate cancer is that if you find it early enough, you can survive. The survival rate is very high. So that's why I always believe that you should be testing consistently, even though some medical professionals are saying we shouldn't have to. But look at it this way: would you rather live for a much longer time, or would you rather die? That's kind of the essential question you always have to ask yourself. Now, the second one was an interesting study that was published this past week from Europe, of all places, in Sweden. They did a study that started in 1963, where they measured men's health, and one of the things they were doing was measuring, obviously, their lung capacity in regards to fitness and whatnot. And one thing they were kind of keeping an eye on was smoking. And throughout the duration of the next 50 years, when all the patients eventually died off, because the patients were 50 years old when they started this, with about 100,000 different men in Sweden. Anyway, as the people died off, they noticed a pattern that The smokers that were in this particular study group, yeah, they lost years on their life. They died much sooner than, on average, than some of their non-smoking counterparts. But also one thing they noticed is that was this: men with less lung capacity or less oxygen utilization in their bodies also died at a much faster rate. And strangely enough, they called it, they kind of equated to fitness level. So men who were less fit, less capable of doing physical day-to-day things, that was the second leading, how do you want to put this, shaver of years, I guess, in regards to health behind smoking. And the lack of fitness was actually higher than heart disease, diabetes, high cholesterol, all those other things that we think are are kind of the boogeyman of everyday life. But not being fit and healthy is almost as bad as smoking. So I found that kind of interesting because one thing that is definitely helped me with my life is getting on the health and fitness kick that I've been on. And truth be told, when I was 400 pounds, that was probably one reason why I really didn't start getting sick at all by the time, because I changed everything when I was 34 and I'm 38 now. And even at 34, 400 pounds, I was still considered healthy. And that was mainly because I worked kind of a manual labor, physically active job. I wasn't always sitting at home. And so I think just having a slightly better physical capacity kind of helped me ward off some of the problems I was potentially looking at. And now that I fixed up my diet and went vegan, I've become more fitness conscious. That's definitely helping me as we speak, and definitely my lung capacity is much better, my fitness is much better. I mean, I can do things that I probably could have never imagined doing 4 years ago. So anyway, take a look at the two links I have in the comment section on this particular video blog, and check out the two blog posts. I think they're, especially if you're a gentleman like myself, I mean, this is the kind of stuff we need to start focusing on in our lives, because I think this is kind of a theory of mine, of course. I mean, you can go ahead and call me stupid, but I just think that, America needs men to be unhealthy. They need men to not care about their health, because let's face it, they need somebody to sell all that Viagra to. They need somebody to sell low T, keep those clinics open. They need to figure out some way to keep consumption up, keep the medical industry going. And let's face it, men are impulsive, they're stubborn, they can be dumb, they can be extremely easy to control in terms of a manipulation. So we tend to do things that don't benefit our health. And some people might consider me weird for being healthy and being vegan, and I still get looks every now and then when I tell somebody I don't eat meat. So it's kind of weird to me that men's health beyond sexual dysfunction seems to be kind of a little talked about concept in our culture, and that's definitely something I'll keep harping about. That's definitely a theory that I firmly believe in, because I mean, other than let's face it, two major stories about men's health, nobody even knows about it probably. I mean, we're too busy talking about stupid dresses and dumb speeches at the RNC and the DNC. So anyway, check out the two blogs at partisanspersonaltraining.com, and just keep following. I'm going to try to keep my my video posting up as much as I can. Right now I'm more busy looking for work. So I'll try to keep up as much as I can. Anyway, I hope you all have a good day, and take it easy. This is The Leap. This is my blog reaction. Follow me on Instagram, follow me on Twitter if you dare. And y'all have a good day.